This recording in this lecture for PTA103 modalities is going to be discussing the Game Ready injury treatment device system, which is a form of intermittent compression. The PowerPoint itself is provided by Game Ready itself, so credit goes to their company for this system. The actual Game Ready unit itself comes with a couple different unit parts. It comes initially with the actual intermittent compression unit. It comes with the cabling that will allow the fluid and the pressure to change, and it comes with the compression garment itself. It was developed by Game Ready in order to help elite athletes get back to sport. The company was founded in 1997 using NASDAQ technology. 2001, Brian Maxwell was one of the first people that kind of used this. It was launched in 2002. Since then, 60,000 patients or more have been used. It says in 2008 it's probably more than, I don't know what the actual numbers are at this point. Over 550 professional and college sports teams use Game Ready, including right here in our own town, UNLV. So pro athletes, pro teams, universities, even clinics are now using the Game Ready system itself. Here's a couple testimonials on it. Cold and compression standard, this is exactly what we talked about in the compression thing. Cold therapy such as ice packs, cold packs help reduce pain, reduce swelling, and reduce muscle spasming. The major problem with the cold packs is inconsistent uncontrolled temperature, poor coverage of the injured area, could get leaking if we use actual ice bags, and you have the potential for frostbite if the ice is cold enough and you leave it on long enough. Traditional problems with wraps and bandages do help with controlling swelling, but again, doesn't apply precise pressure and also only provides pressure, doesn't provide any cooling effects. So Game Ready will combine that. Here's some infrared pictures of what it looks like after Game Ready. So CryoCuff is another version of it, but that has no compression to go along with it. It's simply ice. And here's an example. So this is the CryoCuff here, and this is the gel pack. This is just our normal ice pack that we'd normally use. So you can see with the Game Ready unit, immediately after treatment, the whole area of that leg is going to be numb for that patient, which is fantastic. It also will reduce swelling immediately. Offers more therapeutic benefits than other methods. The main thing I want to talk about with this is, especially if you're ever interested in owning a clinic, cold packs and hot packs are going the way kind of out because insurance companies don't pay for them. Cold and hot packs are now just an unpaid modality. They are an untimed modality, which means that if you use one cold pack for the day, and you put a cold pack on a patient, such as, if you say you're in the hospital setting, you put a patient on a cold pack in the morning, you put a patient on a cold pack in the afternoon, you still only can bill once for that as it is an untimed unit. Whereas this is billed as intermittent compression because it does have intermittent compression. That allows you to bill for this the entire time. There's various different versions of the Game Ready here you can see. There's a knee unit, ankle unit, low back, arm, hand. This is the newer hip unit they have out there. There's the full leg, shoulder, and here's the lower forearm unit. How many patients do you actually treat with ice? Depends, right? Most clinics, patients come in, they go on hot pack, they go out, they go on cold pack. Both those modalities that are not reimbursable. So that can cause a problem. Or in this case, when we do it with vasopneumatic compression, you can reimburse them. So this is going to be a timed unit, meaning if they stay on for 8 minutes, we get 1 unit. If they stay on for 23 minutes, we can get 2 units out of this. And it does reimburse anywhere from $11 to $20 per treatment, depending upon the insurance rate. Treatment protocols are used by other customers. Day of surgery, no compression or low compression as indicated. Most of the protocols themselves are going to be set by the doctors, but then once they get to the outpatient clinic, we kind of set those as well as the PT. Low pressure is usually what we use. Medium pressure is the max we tend to do with most of our patients. Again, we're not dealing with athletes, we're dealing with injured patients. You can use high compression, but it's just a little uncomfortable for most patients, and mainly because of the cold. Most patients don't tolerate cold to begin with. So this is the unit we're going to actually be borrowing for UNLV. I'm hoping to have that shortly. If there are any questions about this, please feel free to email me. Thank you very much.